Well, the impact, what doctors are calling long-term or long-haul COVID-19 is becoming clearer and includes mobility difficulties and lung issues. Dr. Reena Mehta joins us to explore this phenomenon and what experts are learning. Good morning. Happy Mardi Gras.
Good morning. Happy Mardi Gras. Thanks for having me.
Absolutely. All right, so let's talk. We've heard this in the past several times, long-haul disorder. What does that mean, especially when it pertains to COVID?
So long haul COVID syndrome is, something we've recognized over this past, several months. And it's basically people who get COVID-19 infection, which can be even mild or severe infection, who have persistent symptoms outside of what we would think would be the normal infection course. So usually the infection course pattern will be about 2 weeks. Well, these are people who have persistent symptoms for weeks or months after the initial infection.
Wow. Okay. So this is something that, even if you say it can happen, even if you had a mild case, you might feel like, oh, I can get over this in no time. And it's not something that really affected me, but it could continue to affect you for a while.
Exactly. You may feel like after you've had the COVID infection, you kind of feel initially back to normal, and then it can hit you weeks to months later. And so the typical symptoms would be chronic fatigue, persistent shortness of breath, brain fog, feeling anxious, depressed, feeling like you have joint pain, difficulty sleeping. So these are all things that, we've started to recognize over the last year that patients who just get hit with this infection, just really can't seem to recover well.
Okay, so those symptoms obviously, are something that people can look out for. Is there some way to continue to treat that? Is there any sort of medicine for that, or what could help?
Yeah, so that's a great question. I think initially it was just trying to figure out what are the patterns. Now we're finally recognizing that this long haul COVID syndrome really is truly a syndrome. And so now that we understand that it exists and doctors and researchers are looking into it, at the current time, there's no treatments, but there are now these post-COVID clinics that have formed around different places where you can basically be seen by a multidisciplinary approach. So you'll be seen by different specialists. Most patients with long-haul COVID syndrome need to be seen by a pulmonologist, a lung doctor, a heart doctor, a brain doctor, and often a psychiatrist, just to get an appropriate treatment plan in place and try to get these patients feeling better. Because this syndrome is actually fairly common. So depending on which study you look at, about 50 to 60% of patients who have had COVID-19 infection can actually have long-haul COVID syndrome with at least one symptom after the infection. So it's actually not an uncommon thing that can happen to patients, and it's really important to understand. And if you are somebody who is suffering from this, to know that you're not alone and that it can take time to fully recover.
Wow, that's certainly worrisome to think about the fact that it could go on even further. It really makes you think that folks should double down on their chance to go get the vaccine, and then also double down on protection until you can get the vaccine and even after.
Exactly. There's actually some trends that we've noticed. There was one study that looked at over 4,000 patients, and they found that women were more likely to have prolonged COVID syndrome than men. The average age was about age 45. And so, younger people are having this problem too. And they found that if you were hospitalized, you were older, or you were a female from COVID-19, you're more likely to suffer from prolonged COVID syndrome.
All right. Well, thank you for that, explaining that for us. Certainly something to keep an eye out on. Go enjoy the rest of your day. Thanks so much.
Thank you. Great to see you.